Hi, I'm Dr. Heidi Levine. Today I'll be speaking on physician resiliency, survival tips from a doctor mom on the front line. That would be me. In the next few minutes, I hope to give you some pearls of wisdom that will help you have long, healthy careers in emergency medicine. I'm like a PGY 32 and a half or something like that, and I still believe EM was the right choice for me. Interestingly, though, it was not my first choice. I thought about pathology, but the patient interaction kind of limited. And I thought about pediatrics, but the screaming and crying from the parents, forget it. Urology piqued my interest, but back then, being a female urologist was harder than finishing the final obstacle course on American Ninja Warrior. And then I found EM. It had procedures, critical care, patient interaction, and when you're off, you're off. It was the perfect fit. So my first pearl is to find the field that's your perfect fit. I'm a child of the 60s. I grew up with a really cool mom. She taught me all about controlled breathing to help me relax. And she taught me to write in my diary to get my thoughts out on paper when I was troubled. I think you call it narrative writing. My cousins were hippies. They taught me about yoga and meditation, and I didn't think much about it then. But those skills got me through some pretty tough times in my career. So my next pearl is to embrace your healthy coping skills. And if you don't have any, now's the time to get some, because the ER can be chaotic and stressful. And knowing how to get yourself through a tough shift will help you thrive in and out of the department. A lot of you will get a pet before you decide to have a child. Some of you are dog people, some of you are cat people. Me, I'm an amoeba person. They don't fetch or go in a litter box. They just go with the flow and they're happy little amoebas. But here's the interesting thing. When they feel threatened, they close themselves off into a little cyst, and it protects them from whatever danger might be in the environment. So here's my recommendation and my next pearl. Do your best to go with the flow in the emergency department as you're going through your shift. But sometimes you need to know it's okay to take a step back. Self-care is critical to building resilience. Now, balancing got a lot harder when I threw 3 kids into my mix, along with more administrative duties. One has a play date, one has a soccer game, one has a field trip. You have to know who needs to be where and what they need and what time. You have to be very organized. It's important to prioritize everything. So here's the 4th pearl. The most critical issues go first. Doesn't matter if you're at home or during your shift. That's how it works. Another tip for staying sane as a parent and an ER doc is to have a strong social circle. You don't have to have doctors as friends, but you have to have friends that you can have fun with and that you can count on through thick and thin. Psychology teaches us strong social supports are an important part of resilience. And if they're really, really good friends, when you're working a night shift, and well, let's say your twins get into yet another fist fight, and now one needs sutures, and there's no one home to bring them to the ED for the sutures, well, even though they have a 7:30 dinner reservation and it's Valentine's Day, they'll bring them. So your friends get you through. Now, you can't go anywhere without hearing about burnout and anxiety these days, and you may think it'll never happen to you, but I have to tell you it might. Don't worry, not permanent like herpes or a scar, okay? I had an administrative position that I loved, and unfortunately, budget cuts happened, and I lost it. So it really took a toll on me, and I was smart enough to reach out to someone who gave me a new perspective. Ultimately, it was a positive. It brought me back to wellness where my roots are. So the pearl is don't be afraid to ask for help. It's a sign of strength. Now, the last thing that I expected when I submitted this talk for SAEM was to actually be a frontline provider in a pandemic. But my team is awesome, and we got each other through it. And I was grateful for them every day. So I'm going to recommend as my last pearl to practice gratitude. It will lift your mood and build resilience. Now let's review. Find the right fit, practice healthy coping skills, do self-care, have a strong group of friends, be organized, don't be afraid to ask for help, and always look forward. Thank you for your time.